We are back on MorningLine. Thanks for joining us. Noreen Gibbons is with us, Middle Tennessee Audiology there in Hendersonville. It's nice to have her on. We've got the phone lines open talking about hearing loss. 737-7587. Waiting through the break with Sandra. Let's take Sandra. Sandra, good morning. Hello.
Hello. Did you say Sandra?
Yes, yes.
Oh, okay.
Sure, go ahead, ma'am.
In 1986, I had a bad car accident, and I had, they said that I had central auditory processing disorder, it's a brain disorder, and a lot of times it doesn't register. For years, I'd be talking. A lot of times, I could hear you speak, but it doesn't register in my head. And now, I'm 64 years old, and now I have a lot of ringing in my ear, tinnitus. And I went to the audiologist. I went to 2 or 3, and the hearing aids are expensive. But I still have a problem with the register because of the brain accident, the brain injury.
Sure. Yeah.
Now, Sandra, I'm just wondering, do you have also a peripheral hearing loss or hearing loss in the inner ear as well?
Yes, I have. After I got older, I have half of my hearing is gone, and I have a constant ringing, tinnitus, a constant ringing, and it bothers me so bad.
And have you had a chance to have some sort of demo with a set of hearing aids to see if it helps not only the hearing but to reduce some of the annoyance from the ringing?
Yes, yes. But I just can't afford to buy them. I can't afford the ones that they want to give me is over $2,000 a piece.
Okay.
And I just can't afford it.
And have you asked your health insurance plan if they have any coverage? Because sometimes that's changed over the years, and they do. The other thing we can look at is there's an organization called Hear Nashville, and that is a financial aid program. It's run by the Vanderbilt audiology students, and so much of it is overseen by the audiologists at Vanderbilt and the universities, and they really do a good job of helping people get assistance for the cost of hearing aids. And again, it's called
how do I get in touch with them?
I'm going to need to get back to you. I don't have their phone number.
I'll have back there, maybe Rick or Mary Elena can Google it and see. It's called Hear Nashville. I'm sure HEAR Nashville.
Correct.
And it's affiliated through .org, hearnashville.org, and it's through Vanderbilt, do you believe?
It is Vanderbilt students, yep.
I'm so glad you mentioned that. I was hoping there was something like that out. Just stay tuned, Sandra. Stay with us, and we'll mention it on the air here if and when we can find the number. They'll check for it right now. So, yeah, a lot of people need help. Okay, and I think they've got her on the line, and we can share that on air too, Rick, at the end if you guys want to put something together. But okay, so here's a woman who needs some financial help with this, and we were talking to the break about an effort to try to get is it a hearing dog for a child? Not a hearing dog. I've heard about seeing dogs.
Yes.
But these dogs, how do they work?
Well, just a little bit of background. When I was in Michigan, I did have a lot of patients who had hearing assistance dogs. And I think it was more common because the leader dogs for the blind were based in Michigan and near the area I lived in, and there was just a lot more understanding about what service dogs could do. Unfortunately, there's not any local facilities that train these dogs, but a hearing assistance dog is a really great, don't want to say tool, but really great help for someone who, when they're wearing hearing aids during the day, you know, there's a limit to what the technology can do. There are certain things it can't do. For example, hearing dogs are trained to alert their owner if someone calls that person's name in a crowded environment, and maybe they don't hear it well.
Meaning, and they're looking the other way.
Correct.
They can't see, and it's behind someone's calling.
Yes, so that dog would know to alert its owner. But even more importantly, hearing aids and cochlear implants come off at night. They really have to. You can't sleep in these devices, sweat, all of those things, losing them. So warning systems. For example, the young man that I was telling you about, his parents, he's at the age where they would, you know, like to leave him at home alone sometimes when they go out or different activities. He's old enough to be left alone, but they're concerned, will he hear a tornado warning?
Is he deaf entirely?
No, he's hearing impaired.
Which,
right.
Okay.
So if you're doing something, for example, that age group's doing a lot of video games, concentrating, you know, all of that, maybe headphones on so he can hear and interact. I have a 23-year-old who's probably doing that right now at home.
My son just zones out.
So being able to know that there's someone at the door, that the phone is ringing, that so safety is a huge concern, and we all want our children to be independent, and that is an issue of independence for this young man in Gallatin. So we will be in touch with you more about helping with that. We're doing a shoe drive right now, and that shoe drive is supporting his purchase of the fees for a hearing assistance dog.
I'm sure most of those, the specialized training, those dogs are not cheap.
They're not, no.
But that's so interesting. I know a lot of people who do have hearing problems will have phones that flash a red light, or have a doorbell when it rings a light. But you know, you don't always see that. Having a dog with, for a lot of the things, and I'd forgotten, none of the hearing aids really are made to be slept with. Is that correct?
They're not. Yeah, they. You know, when people do, we can tell. We see rust in the battery door. We see chronic ear canal infections.
Oh yeah, right.
We see things that. I had a young woman back up in Michigan who refused to take hers off at night. She'd come in and her ears were so inflamed, and they had to have been painful. But she was afraid to take her hearing aids off. Would have been a great candidate for
and
a
there's
dog.
no real reason, afraid meaning that she wanted to make sure she could hear everything.
Correct.
All right.
She was afraid she wouldn't hear things.
But it's easy enough to put, like for instance, this is called an IFB, as you know. This is something where I can pop it into my ear. It's molded specifically, custom to my ear.
Right.
And it's two-shot there. See, there it is. It's this thing that comes out. And that way Mary Elena or Rick can talk to me and it pops in. It's easy enough to put. Is that pretty much the same as a hearing aid?
Yep.
Kind of the way they just kind of go in different ways?
Absolutely, yep. Yep, that's pretty much
piece
the
of
same.
cake. All right,
yep,
that's nice to know. That's not that hard.
And not very noticeable if people are concerned about how it looks, and they're comfortable.
Yeah.
So.
Okay, let's go to Jim. Jim, good morning. Hi, Jim.
Morning. Good morning.
Good morning to you. What's on your mind?
Okay. Can you talk about ear clicking? I have clicks that occur about every 1 to 2 seconds, and then they progress into becoming a rapid, loud clicking, what I call a rattling, for anywhere from 5 or 6 seconds to as long as 4 hours. They started about a month and a half ago after I had a severe throat infection that migrated into the eustachian tube into my left ear. On my left ear, I've had 5 operations for the bone structure that calcified, and the operations didn't work. I have about 85% hearing ability in the left ear, even though the connection between the eardrum and the inner ear is not working.
Yeah, is that in both ears, Jim? Is it clicking, or is it in one ear?
Left ear only.
Left ear only?
Interesting.
That's what we call a secondary tinnitus, meaning there's a physical structure that is causing that. There's some good news, and I want to tell you some good news is that for most people, things like that come up suddenly become less noticeable over time. Now, yours is a little bit different because there's probably something physically with the eustachian tube that's causing that. I'm really going to have to refer you back to the surgeon to talk to them about it and what they might be able to do. Have you spoken with your surgeon about that?
I have, and they I guess you'd say briefly, said that clicking was just a type of a tinnitus, and I also have the ringing tinnitus, which I've had for years and years in both ears. But the doctor said there's really nothing much that can be done.
Well, I would encourage you to try some things on your own to see if sound reduces the annoyance. For example, using some headphones, because then we would know if a hearing aid might not only help the annoyance, reduce the annoyance from the tinnitus, but also help your hearing. So yeah, I would go back and ask for some different treatment options from the audiologist that's associated with that ENT, because there are some things they could try. Again, much of managing tinnitus is trying to reduce the annoyance from it so that it's not so bothersome for you.
Right. Now, I have tried different things, and by chance have looked up on some relief. I have the spinal problems in my neck area, so I do a series of manipulations, stretching, and so forth. And when I do that, the clicking goes away. But of course, I can't continually be doing that, those maneuvers and walking around looking funny, you know.
Right.
Another thing that I've learned is if I use a vibrator on my the left side of my neck and the skull, that especially at night, it will go away for most of the night. So I do that every night, just about. But a lot of times, say around 4 o'clock, the rattling comes back, and it's very loud.
Wow.
I am really glad to hear you tried some of those things and got some relief. That's awesome. So good for you. Keep up doing what you can, maybe talking even. I know some people have gotten help from chiropractors on this subject.
Yeah,
so.
that's interesting. That's a good point, because it sounds to me like if he's massaging with the vibrator in this area and it changes, it's almost like a muscle or something.
Correct.
Right?
Yeah. It's a little more unusual type that he's describing, but yeah, absolutely, there are some benefits to seeking chiropractic help for that.
All right, thank you for your call, Jim, and that's good advice. Hopefully that helps. Sounds like he's trying what he needs to do and experiment with it and get with his doctors. Let's go to Linda. Hi, Linda.
Hello.
Hi, how can we help you?
Since Q-tips are not allowed, how's the best way to clean the wax out of your ears?
Well, we were talking about this a little earlier, and I do not recommend those candles. In fact, there was a fire in Hopkinsville, Kentucky not too long ago, started by ear candles. Did you report on that, Nick?
We probably.
Okay. So,
I don't know. That would have made the news. An ear candle starting a fire. No, those ear candles. Yeah, you hear about those sometimes. You see them sometimes in the health food stores or something.
Right.
Where you light, but those things can be dangerous.
They can be dangerous, and they also, when you look at the evidence, there have been studies that really tried to look seriously, not biased studies, but really wanted to see, does this work? And the answer is absolutely not. They don't.
Okay, is earwax necessarily bad? I understand too much, but I mean, we have earwax. Your ear doesn't have to be spotless of wax, does it?
Correct. You want to, you really don't want to have an ear completely clean of wax, Linda, because it does act as a deterrent for insects. I know we don't really want to think this way, but it's true. And there are some purposes. Earwax can also trap dust and dirt and keep it from getting down on the eardrum. Now, for some people, if there is excessive earwax, the best thing to do, first talk to your doctor, or if you've ever had a history of surgery or perforated eardrum, you need to see an ear, nose, and throat specialist or a medical specialist to have that treated. But there are over-the-counter drops you can use. Hydrogen peroxide is one of the least expensive. Just make sure you're sitting down or laying down when you're using that, because the temperature effect can make you a little dizzy.
Oh, interesting.
Yeah, that's how we test balance. But there's something called Earwax MD that I've used on my own family members and has worked quite well.
It's just kind of a flush?
It's, the Earwax MD actually dissolves the wax and then you flush it out afterwards.
Just with some spray water or something?
Correct, just using water afterwards. But for most people, it doesn't need to be removed on a regular basis. It's like every habit that we have, we feel like that's part of our hygiene, but it's really, for most of us, not necessary to do that.
By the way, as we go to the break, in terms of Q-tips, we understand the reason, and I'll be honest with you, Doc, I've used Q-tip when, like, for instance, we cover fires sometimes, and you talk about how the earwax grabs dirt and stuff, and so my ear will itch. Now, I've used a Q-tip before to do the periphery of my ear, and I will go in just the outer channel. Is the big concern with ear Q-tips is that people are getting it and jam it in there, and then all of a sudden injure the drum or something, right?
And that often it pushes wax back in, and it, you know, you scrape the ear canal, something like that.
So I'm not suggesting anyone else. I guess I probably shouldn't use it at all, but on occasion I've used it just on the peripheral outside of the ear, but never in, and that's, I think I understand why. Let's take a break. When we come back, we can take more of your calls, our final segment with our guest, more conversations as well about hearing aids and maybe how to know when you should go to a hearing specialist, because, you know, how do you know if something's too loud? How do you know if you're the one yelling like I do most of the time and I really don't need to, but it's my hearing? We'll be right back after that.